When am I allowed to start panicking about the Children's Health Insurance Program, otherwise known as CHIP? Now? Is now okay? Because I think it's now. This is Healthcare Triage News. From 1980 through 1984, the uninsured rates for kids and non-elderly adults were almost identical. Since that time, however, they've diverged dramatically, so that by 2012, about 15 percentage points separated the two. How? This dramatic turn of events was achieved through expansions of public coverage, specifically Medicaid in the 1984 Deficit Reduction Act and the Children's Health Insurance Plan, or CHIP, in the 1997 Balanced Budget Act. In 2013, more than 41% of children were insured through a government program, again making them more dependent on public coverage than any group except seniors. CHIP is pretty great insurance. CHIP plans have an actuarial value of greater than 90%, making them much more generous than silver benchmark plans in the ACA with an actuarial value of 70%. The increased cost-sharing families might encounter by moving to private plans might leave even more children underinsured than before. Deductibles, co-pays, co-insurance, and even premiums are usually much less in CHIP plans than in exchange plans. When the Affordable Care Act was passed, Congress also reauthorized the CHIP program. Many felt moving too many children from CHIP too quickly might be disruptive. In 2015, CHIP was reauthorized, until a few months ago. That's right. Federal funds for CHIP expired on September 30th, which is when, if you follow me on Twitter, I began to panic. The House has passed a bill to pay for CHIP, but only by making it easier for people to get kicked off Obamacare. In other words, we'd have to take insurance away from about 700,000 people to pay for insurance for kids, and that's not really an idea popular in the Senate. Everyone keeps telling me not to worry, no matter how many times I panic on Twitter, because they'll figure it out as part of a deal to keep the government going when it runs out of funding on December 8th. But have you looked at Congress lately? I'm not sure they'll get a deal to keep the government going in a week, let alone CHIP. There are 50 CHIP programs, not one, because it's a state-based program. They're all scrambling, trying to figure out how to make their budgets work. Some, like me, are panicking. They may have to choose between capping the program, freezing it, or shutting it down. It's a nightmare scenario. Some states are preparing right now to send letters to their residents telling them that their kids might lose coverage soon. As Annie Lowrey wrote over at The Atlantic last week, and I'm quoting her here, Hill staffers insist and the states anticipate that Congress will pass new funding for CHIP in the coming weeks. But the situation has left doctors fuming, administrators bewildered, parents frightened, and politicians shocked. Even if no states end up running out of money and no kids end up losing coverage, the dithering has already diverted state resources, degraded state programs, and sapped state coffers as Congress's dysfunction has pushed the stability of an effective, respected program with bipartisan support into doubt. I don't know if I can say it better than that. It's now time for everyone to panic, not just me. If they don't fix this in the next week, the nightmare scenarios become real. We like to make videos about topics that sometimes YouTube doesn't like to sell to advertisers, and we're fine with that because we're gonna do what we think is important. But it helps to get support from viewers like you through things like Patreon.com. Patreon is a subscription service that allows you, the viewers, to support the show and the content we create in ways that don't have to go through all the rigmarole with ad fees and all that stuff. You can go to patreon.com/healthcaretriage if you'd like to support the show. We'd especially like to thank our Surgeon Admiral Sam and our research associates Joe Sevitz, Joshua Crow, and Carlos Gallegos. And if I'm pronouncing that wrong, Carlos, you let us know. While we've got you, we'd appreciate if you'd subscribe to Healthcare Triage, like the video, and it's the holiday season, so consider going to hctmerch.com, picking up some Healthcare Triage merch. I also have a new book out, The Bad Food Bible makes a great holiday gift.